So now let's take a look at the risks and benefits of hormone therapy. And I'm going to review with you the FDA guidelines regarding hormone therapy, which include the following. Estrogen and progesterone are approved for relief of hot flushes and symptoms of vulvar and vaginal atrophy. What is preferred are low doses of vaginal estrogen. Although hormone therapy is effective for the prevention of osteoporosis, it should only be considered for women at significant risk of osteoporosis who cannot take alternative treatments. And additionally, estrogen and progesterones should be used at the lowest doses for the shortest duration in order to achieve treatment goals. Now, a useful summary of the risks and benefits of hormone therapy have been provided by the North American Menopause Society, which has stated, because the incidence of disease outcomes increases with age and time since menopause, the benefit-risk ratio for hormone therapy is more likely to be acceptable for short-term use for symptom reduction in a younger population. And then, in an updated version, the risk-benefit ratio is less favorable when hormone therapy initiation is considered in women greater than 60 years or those who are more than 10 years post-menopause. Late initiation of hormone therapy is associated with an increased risk for coronary artery disease events, venous thromboembolism, and also dementia. It's my opinion that it is important for psychiatrists to know the current information on the risks and benefits of hormone therapy for their patients, which is why I am reviewing this data with you. So let's look at the Women's Health Initiative data, which is data from a very, very large community-based study on the risks of hormone therapy in postmenopausal women. So overall, women on combined hormonal therapy or estrogen alone had fewer fractures but more strokes, blood clots, gallbladder disease, and urinary incontinence. It's important, though, to know that for strokes, blood clots, and all-cause mortality, safety was greater in younger women close to menopause. Now, with regard to the issue of the risk for breast cancer with hormone therapy, let's look at that data from the Women's Health Initiative. And what they found was that estrogen plus progesterone increased the risk for breast cancer, with the risk amounting to about 8 additional cases of breast cancer per 10,000 users for 5 or more years. The researchers concluded that it probably takes 10 or more years of estrogen monotherapy before the risk for breast cancer goes up, but only 5 to 6 years if combination estrogen and progesterone therapy were used. So, what about the risk for heart disease with hormone therapy? This is so important because we know that heart disease is the #1 killer of women in the United States. It appears that most healthy women below age 60 will not have an increase in the risk of heart disease with hormone therapy. Nevertheless, hormone therapy is not recommended for protection against heart disease. The current hypothesis is that estrogen may slow early stages of atherosclerosis in recently menopausal women, but may destabilize plaques or clots in older women who may have advanced atherosclerotic lesions. So, moving on, understandably, the issue of heart health and hormone therapy is quite complicated. To summarize, hormone therapy is harmful in older women and in women who are at increased risk for coronary vascular disease. Hormone therapy is probably neutral in younger women or women at low risk for coronary vascular disease. Hormone therapy is probably favorable for women on estrogen monotherapy, in other words, in women without a uterus who have undergone a hysterectomy and are therefore not at risk for endometrial cancer, which is increased with estrogen therapy. Finally, with regard to fractures due to osteoporosis, hormone therapy prevents bone loss and reduces fracture, but there are other treatments with fewer risks than hormone therapy that are preferred to address the problem of osteoporosis and osteoporotic fractures. So let's look at our key points here. So even though psychiatrists won't treat with hormone therapy in most cases, it's important that they know the current information on the risks and benefits of hormone therapy for their patients. Our patients ask us, and it's important for us to know the latest data. For women who have no risk factors for cardiovascular disease or breast cancer, hormone therapy, in fact, may be a reasonable consideration to treat perimenopausal symptoms if they're less than 60 or less than 10 years post-menopause.